The Lifelong Learning Initiative, an innovative adult learning curriculum for emergency medicine sub-interns. Medical school is marked by traditional learning methods. Students are given lectures and assignments, quizzes and practicums. Even in the clinical ward, students are often instructed to purchase such and such a book and learn it, cover to pass the final examination. Their motivation for learning is extrinsic and provided by the need to pass examinations or withstand being grilled by your attending on the wards. Entering residency, these students now need to create their own learning experiences. They need to be able to identify their strengths and weaknesses honestly and know how to correct deficits on their own. Residents need to undergo a fundamental shift in learning motivation and develop skills to learn how each individually learns best. This is the shift to adult or andragogical learning, whose hallmark is learning for the betterment of oneself, not for an examination or to please a parent or teacher. Adult learners are very specifically goal-directed in their learning, and as such, engagement of the learner is crucial to maintain interest. As medical educators, we in the emergency medicine sub-internship are poised to make a significant impact in helping these soon-to-be residents make this crucial and fundamental learning transition. The Lifelong Learning Initiative is an innovative sub-curriculum in our emergency medicine sub-internship designed to change attitudes and promote self-directed learning. Curricular components are daily self-assessment practice, 5 hours of classroom time, 2 hours of asynchronous learning, and a final project tying key learning objectives together. Learning objectives for this curriculum are as such. Students will be able to analyze their personal learning style, list key features of phone material that represent academic scholarship, efficiently find and analyze different kinds of educational material for quality and accuracy, practice self-reflection and analysis of strengths and weaknesses, practice using technology platforms and applications to provide a stream of focused educational content to the learner to promote self-driven learning, create high-quality EM-focused educational content for an internet learning community, and practice a professional social media presence and understand how HIPAA relates to social media and phone activities. Our first curricular component is daily practice of self-assessment and reflection. Students log each shift on an online form and fill out the self-reflection. These are reviewed by course leadership and discussed at mid-rotation review meetings for each student. Educational sessions consist of small groups, flipped classroom, and a flipped procedure lab, each with their associated asynchronous learning components. All sessions aim to foster a change in learning motivation to intrinsic motivation, learning for the betterment of self, while additionally teaching core EM skills. The first session occurs during orientation and involves a group discussion of the current state of their learning motivation, discussion of core concepts of adult learning, and the importance of finding a passion for learning. The second session is a flipped classroom session. At the end of this session, students are able to identify markers of academic quality in foam. Prerequisite materials include a wide variety of foam material around a central concept. Past years have used foam material to provide an in-depth comparison between normal saline and lactated ringers for fluid resuscitation. Classroom time focuses on evaluation of material for relevance, referencing, authorship, quality, bias, and reliability, and how to locate these markers of academic quality among different forms of foam, including videos, podcasts, and blog posts. Session 3 is a flipped procedure lab. The majority of our students are rotating from other institutions and as such have widely varied instruction on procedural skills. Flipping this lab allows for more experienced students to remain interested by helping to teach less experienced students. Students are assigned internet resources, mostly videos and a few blog posts, to review prior to coming to the procedure lab. Students then work together at 4 stations to perform BVM, IV access, internal jugular central venous access, and endotracheal intubation on mannequins. 2 faculty facilitators oversee the 4 procedure stations, assisting first with technique through prompting and questioning, and then through small adjustments. Flat-out performance of the procedure via demonstration by faculty is discouraged. The lab promotes teamwork, problem-solving, and peer-to-peer education, all crucial skills for EM. Faculty are also able to observe team dynamics, teaching, and learning styles of the students. The curriculum is capped by a final project where students are challenged to create an online educational microlearning module on the topic, an EM-relevant topic of their choice. Anything is game. Students have tried their hand at website design, blog posts, infographic design, podcasts, video instruction, gamification, and even creating iPhone apps. Students work in groups to create a collection of educational material focused around a core EM topic to provide a more comprehensive and in-depth exploration. Final projects must display clear evidence of high academic quality and content accuracy and must both utilize foam and primary literature as source material. This is an example of an infographic final project. This student chose to cover EKG changes in electrolyte abnormalities. Unfortunately, what you can see in this format is that every image is clickable to go to the web source for further reading and information. The student also created a review quiz linked at the top for knowledge retention and review. Note that in addition to the links within the infographic, there are references cited at the bottom of the presentation. This is an example of a final project website build titled The Worst Hike Ever. These final projects are listed along the top here, and this group focuses on a wilderness medicine theme. They also used another secondary tool to tie their projects together by creating a unified clinical vignette of a young man who's hiking and having a really terrible day. To view a final project, example of a final project, let's look at shoulder dislocation. Shoulder dislocation, this is an example of a blog post format final project, and you can see the student used the unified clinical vignette and then goes through an overview of shoulder dislocation, anatomy, diagnosis, radiology, and then enters into the procedural component of reducing a shoulder dislocation. You can see throughout the text that she hyperlinks primary literature references as well as other foam ed references for a further in-depth exploration of the topic. Finally, she created a number of videos herself using another sub-internship student as her dummy patient. These are embedded within the website for seamless exploration.
Hi, so I'm now going to show you the Stimson method along with some scapular manipulation.
At the bottom of her blog post, she also lists additional references that some are hyperlinked above and some are additional beyond the hyperlinks above. Finally, there's a home button to bring you back to the project's homepage so that you can explore the projects of other students involved in the group. Projects are discussed through an online learning community with students able to view and respond to each other's projects as well as receive feedback from course leadership. Our learning community consists of our EMed bound blog and Twitter feed, providing two formats for students to practice participation in foam discussion. Follow us on Twitter at EMedBound and with the hashtags NYPEMSI and NYPEMDC. In its first 3 years of implementation, 221 students completed the Lifelong Learning Initiative. 70% felt that the curriculum and final project were unique and beneficial to their learning and development. The final project was highlighted as something students felt to be highly useful to them as they enter residency. The Lifelong Learning Initiative aims to help students reconnect with what learning means to them and to provide them with the tools to strengthen that connection. We aim to create better doctors through analysis of learning style and exploration of different types of foam matched to individual learning styles. The curriculum provides the tools to optimize foam utilization through apps and feed services. Students practice post-shift self-assessment as part of their daily educational activities and engage in peer-to-peer education, learning with each curriculum session. These are all skills necessary to smoothly transition to adult learning for our new EM interns. Our exit survey data shows that the majority of students feel that the curriculum is beneficial to their careers in medicine moving forward and is a unique part of our rotation, drawing students both to our rotation and residents to our program. Thank you very much for listening.